Alright, let's start this. This is going to take a bit. You have 16 muscles within your hip and leg, for the hip and leg muscles. I'm not going to go over the knee just yet. I boiled it down to 10 because some of them are synergist muscles or they originate and insert in the same spot. The numbers on the side in the screen box indicate the two major roles that they do. So we're going to start with the iliopsoas. Your iliopsoas is technically 3 muscles fused into one. Your psoas major and minor, which come from L1 to L5, and your iliacus, which comes from your iliac crest, or iliac fossa, excuse me. And they fuse together from, the iliacus and the psoas fuse together, and they insert on the lesser trochanter of the femur. And what they do is they flex the hip, and they also externally rotate the hip. Next is your tensor fascia latea. That comes from the anterior part of your iliac crest, not the iliac spine, but the anterior part of the iliac crest, and it kind of goes underneath it a little bit and attaches to the ilium. So it will originate here, and it'll go down the lateral side of your leg, and it will attach to the medial lateral part of your tibial condyle down here. That is responsible for hip flexion as well as abduction, so it'll raise your leg out and up and out. Next is your rectus femoris. Your rectus femoris comes from your anterior inferior iliac spine, and it goes all the way down to your tibial tuberosity. And what that does is it helps with knee extension, like flexing your leg outward like this, and hip flexion. Here we have a muscular version of it. It is part of your quadriceps, and you can see the big one right here. It's a big old muscle, and it attaches here to your tibial tuberosity. Next is your sartorius. Your sartorius is similar to your rectus femoris, but it's also a little different. Instead of the inferior spine, it goes to the superior iliac anterior spine, and it stretches down, but what it does different is it wraps back down behind the tibia, and then it comes back forward just beneath the tibial tuberosity. It is the longest muscle in the human body. I have a little version of it here. You can see it wrapping around, and then it comes back forward. And what that allows it to do is, instead of extending your knee, it flexes your knee. So what movement it would produce in tandem with hip flexion is knee flexion. So it makes this movement. Next is your gracilis and your pectineus. They are on different parts of your pelvis and insert different places, but they do the same exact thing. They both do hip flexion and adduction. So they bring your leg in and up. Your gracilis comes from, let me see. Sorry. Holding you up here. Right, okay, so your gracilis comes from your ramus. The ramus is the bottom part of your pubis. So it comes down here medially, and then it attaches on the medial tibial condyle. Your pectineus comes from the upper part of your pubis, and it attaches just behind the lesser trochanter, not on it, but behind it, and it goes to the linea aspera, and it goes down there. And once again, it does hip flexion and adduction. So some of your knee flexors, we already went over the sartorius. Next is your semitendinosus and your semimembranosus. Those are posterior. Both the semitendinosus and membranosus come from the ischial tuberosity. Only what they do is they both come down medially. One attaches, the semitendinosus attaches to the medial tibial condyle, while the semimembranosus goes down just a little further and just goes beneath the lateral condyle. Both are responsible for knee flexion as well as hip internal rotation. So they're going to turn your leg in this way. Your bicep femoris also comes off your ischial tuberosity, but it comes down and lateral. and it attaches to the lateral tibial condyle and the head of the fibula. So it's going to do knee flexion, and it's also going to do Yes, oh, sorry, hip extension. So it's going to pull your leg back, and it's also going to flex your knee. So it's going to flex your knee and bring your leg back. Next is your bicep, no, we were just at your gluteus maximus. Your gluteus maximus is a big muscle. It attaches to the posterior part of the iliac crest, and it's all part of the sacrum and the coccyx, and it attaches to the linea aspera. So it comes down here, and it helps with hip extension, so it brings it back. It also helps with hip external rotation, so it turns it out and brings it back. Your glute medius and glute minimus. Your glute medius starts at the top of the ilium, whereas the glute minimus is just below the glute medius, and it's still in the ilium as well. Both attach to the greater trochanter of the femur, and they help with abduction. They bring it out. And they also help with external rotation. Internal rotation. So they bring it in and up. Last, is your adductor longus, brevis, and magnus. They both originate from the pubis, or all three of them originate from the pubis. They all originate from the pubis, and they all attach along the femur here. The gluteus, or the adductor magnus, goes all along your femur. The rest stretch behind and only on the halfway part of the linea aspera, so they don't go down that far, but your adductor magnus goes all the way down your leg. And what its name, it does adduction and hip external rotation. So it brings your leg out. Oh, I hope that helped. Now, before I wrap up here, I'm going to point out some of your ribs. We're going to go over the torso. So you have 12 ribs, 7 true ribs, and 5 false ribs. True ribs, what separates them from false is that they have a cartilaginic link to the sternum all on their own, whereas false ribs have to share a cartilaginic link or don't have one at all, and they become floating ribs, these two right here. Now, with your spine, what I want you to remember is at breakfast, I eat breakfast at 7 o'clock, I eat lunch at 12, and I have dinner at 5 o'clock, and dessert at 5 o'clock, and at 4 o'clock I have a snack in the night. So what that means is with your cervical, you have 7 cervical spine, 12 thoracic, 5 lumbar spine, and 5 fused together sacral spine, and 4 little teeny tiny coccygeal spine. She wanted us to do a little more in-depth with it. So here you'll find the transverse process, and that's the side. On the thoracic spine, that is an attachment point for the ribs. Here's the spinous process. That's your very back. If you bend over and feel those bumps on your back, that's your spinous process. Here is the vertebral foramen. That's the hole that your spinal cord fits in. And this chunky part that's completely whole is the body of the spine. Doing a little more anatomy parts. Here is your acetabulum. Your acetabulum is a concave surface, meaning it caves in. It has room for something. And what is inside the acetabulum is your labrum. It is a cartilaginic piece of tissue that supports and helps encase the femoral head. And your femoral head goes inside your acetabulum, and it is a convex surface, meaning it's shaped round. This joint here is called the acetabulofemoral joint. It's a bit of a mouthful. This right here is what you call an inanimate bone. Your whole pelvis is an inanimate bone, which it means it's the fusion of 3 bones: the sacrum and the 2 pubic, or the 2 pelvic bones. This is called the sacroiliac joint. It is the fusion of the sacrum and the iliac. It should be noted that this, the pubic symphysis and the sacroiliac joint and the spine are all what you call amphiarthrodial joints, which means they can only move a little bit, whereas your acetabulofemoral joint is an enarthrodial joint. It can move in any direction, and that's also your glenohumeral joint. The femur inside, the femoral head inside the acetabulum is held together with the iliofemoral ligament. It is the strongest ligament in all the body. Nothing is stronger than that. There's also something called a diarthrodial joint. That is your knee. And it is a joint that can move very freely. And inside is a bone, your patella. So this is an anterior perspective. This is your medial collateral ligament and your lateral collateral ligament. You should note that the lateral collateral ligament is much smaller in comparison to the medial, and that's because what it protects against are what you call valgus forces. Yeah. It protects against the varus force. A varus force is something that's coming this way. It's going to stretch it this way. The reason it's smaller is because more often than not, how is something going to be able to hit your leg from the inside? It's going to be very hard. Whereas with the medial collateral ligament, it is much bigger because the likelihood of something hitting you from the outside and bending your leg this way is much greater. What else did I have to say? You might not see it, but there's something called syndesmosis joints, which is the skull right here. Things like your teeth and the sutures on your skull, they're not meant to move. Oh, God, that was a mouthful. I'm tired.